Hey everyone, I am Carla from Run Again Rover, and everything I do is about CCL recovery, preparation, caregiving, and things like that. I wrote a book on the topic. I am currently doing a client education project with J&J DePuy Synthes Vet about TPLO recovery and caregiving. I have a great meeting today set up for you guys so we can learn more about what life is like in vet med. I want to welcome Dr. Shannon Emmons and Renee Mack today. Dr. Emmons, tell me a little bit about yourself.
Thank you for having me, Carla. I'm Shannon Emmons. I am a small animal general practitioner. I own my own private practice in Southern Maine. I am also pursuing a residency in veterinary behavior, so we operate as a specialty practice. I am on the board of Not One More Vet, the veterinary suicide prevention organization, and I also lead the education committee and a couple other little projects within NOMV, but very involved on the mental health side of both people and animals when it comes to care.
Thank you for that work. And Renee, tell us about yourself.
Hi, thanks for having me. I'm Renee Mack. I've been in the animal industry for about 20 years wearing different hats. While I was a floor technician in a previous life, my most recent has been practice management. I have a bachelor's degree in animal science from the University of New Hampshire, and I've also been for a few years now a fear-free certified vet professional. Prior to that was a certified trainer, worked as a trainer for probably about 10 years. Behavior is my jam, and I very much enjoy being able to incorporate new behavioral knowledge into vet practices.
That's fantastic. So you're both similar in that way with the behavior aspect. Very cool. All right. So Renee, remember
Yes.
when I first met you, it was inside the CCL Recovery Facebook group. And there was a little bit of chit chat going on about veterinary pricing as it relates to medications. And
Yes.
there was a guy who said something like, I believe this is what's going on with vet med. And he talked about pricing, about drugs specifically. He talked about price gouging and this and that. And your answer was really actually quite nice. And you said, what you believe is true isn't necessarily what's going on. So that's what I want to tackle first.
When you purchase medication from your veterinarian's office or their online pharmacy, the manufacturer of those medications is guaranteeing that medication. Supply chains are monitored, temperatures are monitored, formulations are monitored very highly. When you purchase from an online distributor, supply chain is not monitored. There is a very high possibility that you could get not only the incorrect drug, but counterfeit drugs. There is counterfeiting that happens overseas. A lot of the drugs that can be purchased are nearing expiration. And when you get those medications, they are taken out of their original containers. So you don't see what the expiration date is on that medication. That is one reason that if you were to purchase heartworm prevention from your veterinarian and your dog tests positive for heartworm, the manufacturer will cover costs of heartworm treatment up to a certain amount of money. If you've purchased it from Chewy, they will not cover it because they do not guarantee that medication to be what it's supposed to be or even safe.
I never knew that. Is that why pricing is so much lower with the online companies?
It's part of the reason, but also because they're such large corporations, they buy in extreme bulk. So they're getting a bulk discount because they're purchasing so much, whereas your local veterinarian is purchasing to refill their shelves. Their price is already higher than what Chewy would pay.
I see. If the veterinarian's paying more for the medication, we're going to pay more as the pet owner.
Correct.
Do you have anything to add to that, doctor?
No, I think Renee was pretty spot on. I think the really big thing for huge price differences is Chewy often sells stuff cheaper than I can even buy it. Then we have to order it, and I have to pay my staff person who orders it, and I have to pay the person who is filling the prescriptions, and I pay for the medication and the shipping and sales tax, and all of those things add up. So my base cost is automatically more than Chewy's ever will be before we even talk about markup and what a lot of people consider the price gouging. But it's a business too, so I also have to make money to run my hospital. It on average costs $3,000 to $5,000 a day just to open my doors. That's paying my mortgage, that's paying my rent, that's paying my staff and IDEX and every other bill, electric, Comcast, and I have to pay for it somehow. It's not just medication, it's everything that we do. But at the end of the day, veterinary hospitals are a business.
Yes. Wow. And thank you for that transparency and actually giving us an idea of what it costs to keep your practice running. How is it that you come up with the pricing model?
Manufacturers will have pricing for medications and stuff, but everything else like procedural, it's about time. So if it takes 2 of my veterinary technicians to do an anal gland expression and I pay them X amount, and we have to come up with a pricing range for that. And it's the same thing with veterinary time or anesthesia time. I'm paying for the gas anesthesia and I'm paying for the anesthetic machines and I'm paying for the maintenance on the anesthetic machines and the 2 licensed veterinary nurses who are running anesthesia. So there's a that goes into it. And I will say, if I was in charge of setting my own prices, I would be out of business.
Yeah.
My husband is my practice manager currently, and my texts are always like, you have to charge for your time. Like if I'm doing phone calls that are half an hour at the end of the day and I don't get home till 8 or 9 o'clock and I'm not getting paid for that. That's kind of a cost of doing business sometimes, but it's hard to ask people for money when I know that they're at the worst of the worst and at their lowest point. And thankfully I'm a private practice, so I can help those people out. But it's not easy to come up with the pricing structure is what I have to say. I'm sure Renee, as a practice manager, has better math reasons for why.
That's the biggest challenge, is figuring out you have to pay for the time, you have to pay for the equipment, you have to pay for anything used in the process. And I think Dr. Emmons really kind of hit the nail on the head when you talk about staffing, because as the disease process in our companion animals has evolved, so have our medical practices. We have this evolution of disease process that we're keeping up with, just like in human med. So if your dog needs an ultrasound, we can get that for you now, whereas we couldn't have many moons ago. But there is also a price tag associated with that specialized equipment. Bringing up the anesthesia machines, yes, they need to be serviced, they need to be monitored, they need to be replaced. So not only in just the day-to-day operational expenses, you've got to think about capital expenditure. My dental machine has been with me for 10 years and it's a workhorse, but now it's starting to spring leaks. So now we've got to look at purchasing another $7,000 piece of equipment to be able to maintain the services we already offer. That can also be one of the bigger challenges in projecting. You never know when something's going to kick the bucket, but you got to figure out like, okay, what can we realistically plan for? And you may be totally wrong. And in paying for staffing, doctors and technicians, but especially doctors on this point, they didn't go to school for free either. So when you look at, well, I'm paying for a half an hour of doctor time, but you're also paying for all of the education. Doctors have to do continuing education, and so do certified technicians to maintain their licensure. That all costs money, but that also is bringing home better medicine for your pet. When Dr. Emmons said 2 licensed technicians running that anesthesia, that comes with a price tag that's well worth it, because you have trained licensed individuals that know what they're doing. Now, you may be able to go somewhere that is maybe a little less spendy, but I want to know who's watching my pet under anesthesia. Is it an on-the-job trained technician who has 15 years of experience and knows her stuff? Then yes, please have her monitoring my pet. Is it a licensed technician? Yes, please have them monitor my pet. Is it a kennel technician you pulled in and told to read off the numbers?
Yeah.
That's the difference. There's definitely a difference in level of care. And I find that a lot of practices that are offering high level care get accused of price gouging. Why is this so expensive? Well, you do get what you pay for. And education, continuing education, and experience is huge in this field, just like it is in human med.
Yes.
You can work in this field your whole life, and then on your day before retirement, see something you've never seen before. The staff that you love, that greets you, that provides great customer service, that is there to help you out, well, they also need to make a living wage. And for a very long time, our support staff and a lot of our veterinarians were not making that wage. So now they're working hours in practice, running their butts off, and then going to their second job, and then having to come in the next morning at 8 a.m. exhausted, but willing, paying people what they deserve to be paid, monitoring mental health, making sure that everybody's getting what they need so that we can be the best we can be. And that also comes with a price tag.
It's so interesting and all such good points. A little stray kitty came to my house and I adopted her. I could have gone to a place that does lots of spay and neuters. That's all they do. Or I could have taken her to my general practitioner vet, which is what I did. I paid a lot more, but I knew the level of care she was getting. And especially with TPLO. I don't want to get off on a TPLO thing, but like cheaper is not always better.
And I think too, that leads into our specialty practices. They have such advanced equipment. And I think there's a lack of understanding of what their capabilities actually are and what they do every day. I could drive down to Massachusetts for hyperbaric oxygen chamber for my dog if I need to. That's incredible. And the level of skill, these technicians, a lot of people don't know this, but they can go into specialty as well. So once they finish their certification, if they're passionate about a certain area, they can also go into specialty, which is rigorous amount of hours, documentation, specialization to go work at these specialty practices where we're literally doing open heart surgery and crazy things we never would have thought of 30 years ago.
Vet school base cost, I think, is averaging $300 something thousand these days. I paid $260. I started making $55,000, and that was 7 years ago. So, the debt to income ratio, especially when you compare to human healthcare, which is like a whole other thing. But when they get out into practice, they're making six figures automatically. And that's more commonplace nowadays with vet med because, like Renee said, things have caught up. But then you talk about specialty practice, and often they're doing an internship where they get paid $15,000 a year. And then they're doing 3 years of residency where they make $30,000 a year. And then they get out into practice, and sure, they're going to see an increased cost compared to a general practitioner, but they have had all of that student debt now, and probably they're not paying anything for the past 4 years because and that's if they get through everything, like they get their MAPSHA first time, they get sent everywhere, because some people it takes 5 to 6 years to do a residency. I know my residency, I'm probably going to take about 5 years to do mine just because I'm also working full-time in general practice and doing behavior as kind of like a side thing. But I have 4 weeks this year where I have to be gone. That's time I'm not in my practice. So I'm not making money for my practice. I'm paying a relief vet to come in for my practice. It's the cost of the CE. It's the cost of the travel that I'm doing also that I can provide a higher level of care. And then my behavior consults cost $350. And I'm like, I spend like tens of thousands of dollars a year on my education. And I'm like, again, like I would be out of business if everything was left to me.
Your husband's there.
Specialty hospitals, especially 24-hour facilities, you have to pay people more to work overnight. Honestly, you couldn't pay me enough to work overnight. You have to pay to keep the lights on all day. And like Renee said, you're paying for that specialty care. And we have this amazing ability to do it. It just comes with a price.
A pet owner might think, oh my gosh, I bring my dog to the vet and I go to check out and there's a $300 bill, or I go get CCL surgery and there's a $5,000 bill. Must be nice. But we're only thinking of it from our perspective, not the perspective of what it takes to run the veterinary practice. It's huge. What I hope is that what we're talking about today will get people thinking about pricing in a different way and remembering that good care costs money, just like with human healthcare. If I go to a specialist or if I even go to my GP, I don't ever say, my gosh, that cost an awful lot. We don't do that with our medical doctors, but for some reason it happens in vet med. I don't know why. Why is that?
Nowadays, a lot of people's pets are their family, right? The whole household has completely shifted. So it's like with human healthcare, you can go to a hospital dying and get care and you don't have to necessarily pay up front. But then with pets, we don't have that option in, I would say, a significant majority of practices, because we would never get paid if that was the case. People that I let do payment plans, they're people I know very, very well. And still, I've had people leave me with bills and move across the country. So we do have to pay our bills and we need that money up front. So a lot of people feel like they're held hostage to have to pay these vets all of this money. And it's a lot of emotional blackmail sometimes, I feel like, from how they feel towards us when they're like, well, you don't love pets because you're not doing this. And I'm like, no, I would love more than anything to give all of my care for free, but I can't. So to hear people say things like, you're only in it for the money, or you don't actually care about my pet, or things like that. There's a meme that's like, I wake up at 3 a.m. talking about your pet. There's no extra charge. I had a dream about one of my patients last night, and I was having a seizure, and I woke up and was like, why am I dreaming about this patient having a seizure? We care so much, but we also need to be paid a living wage. And if you want to keep seeing your same professionals that you know and love and have a relationship with, like, we have to make their journey in vet med sustainable.
Regarding costs for vet care, if we're having a hard time paying for care, what can we do?
It really depends on what the challenges are specifically. There are organizations that you can apply to that provide grant funding. A lot of them are very specialized. Some only do cancers, some only do certain hospitals. So you really have to do some digging to figure out what's local in your area. We have quite a few in New Hampshire, actually, that work with seniors, and a nonprofit that's going to be up and coming soon that existed about 10 years ago and had to close is reopening its doors, that provides pet food assistance and veterinary care funding. So there are options out there, but it's important to anticipate that this will happen. It's not if it happens, it's when it happens. Something will happen over the lifetime of your pet. I recommend even $20 every 2 weeks into a savings account just to account for those unforeseen situations. Most hospitals accept care credit and scratch pay. Those are usually your first lines of see if you can qualify for this. But it's really important from a pet parent perspective to understand what you're getting into, because I had someone just a couple weeks ago who struggled to afford their cats, who I did extend payment plans to, who didn't pay. Then the cat needed to be euthanized, which I allowed them to do, even though we had an outstanding bill, because like Dr. Emmons said, we care. I'm not going to allow that patient to suffer. And then called me for a reference because they were adopting 2 kittens.
Oh my. Ooh.
And this person said to me, well, I feel like pets are no longer a right anymore. Well, they're not, and they need care. They're sentient beings.
Yeah.
60 years ago, we thought they didn't feel pain. We've come so far in our knowledge and understanding, but I think pet owners really need to be prepared for those what ifs. I'm not saying that you're going to need to have a $15,000 specialty surgery. But what if you do? There are pet insurances, which we highly recommend for people to get as young as possible, as soon as you get that pet. They come with pre-existing condition clauses. So for TPLOs, we see this in the group all the time. My first knee went, who will insure me now? So when the second knee goes, there's bilateral clauses in almost all pet insurances. So we always recommend people get it as soon as possible, and also to be aware of the breeds that you're purchasing. If you get a Cavalier, it's probably going to have a heart problem within 5 years. And I think don't quote me on this, it's 90-something% of all Cavaliers have a heart problem by the time they're 10 years old. It is the #1 cause of death for them. And I love Cavaliers. They're wonderful little dogs. But if you get this Cavalier puppy, you need to know the second that a murmur is heard, you're going to be doing chest x-rays. There's a whole progression of monitoring and cardiology that comes along with this breed, in addition to chronic eye and ear problems. We have people who come in with Frenchies. Frenchies are huge right now, making fluffy ones, and they're selling for 20 grand. And we have people come in with their 8-week-old Frenchie puppy that they paid $7,000 for, not understanding that, well, now we need to do vaccines. What do you mean? It was all up to date. No, up to date for an 8-week-old, which is 1 distemper. So it's an understanding of what you're really getting into, because that $6,000 puppy will now needs a $7,000 Nair surgery because it can't breathe. For a society that does a lot of Googling, I don't think we do enough sometimes, because the lack of understanding of these certain breeds and their specific potential conditions and genetic conditions just seems to not be happening. And then you can see the overwhelm on this person's face because they had no idea. They just wanted a companion for their kids. And now we're talking about monitoring a heart problem for a puppy who's only 3 months old.
It's so important to think about that stuff ahead of time. And you're right, with the insurances, we're seeing how pet insurance is changing and they're not renewing policies and things like that. And even when you have pet insurance, I'm not sure, I don't know, I didn't understand it. I still don't. It's just like healthcare for humans, like, do we really understand our policies and what we're covered for? Probably not, until you start paying for it. That's when it gets real, right?
Mhm. Yes. And I think too, that's one of the biggest questions we get a lot at the vet's office is about pet insurance. And we're not insurance agents. So we just recommend to people to do their research, but think about what works for you. Some have breed exclusion conditions. So that pug is going to be excluded from an ear surgery because it's a pug, and insurance assumes it's going to need it. It's excluded already as a breed condition. So you have to look at those as well, not just in coverage amounts.
Anything to add to that, Dr. Emmons?
Yeah, I think there are always lower, I mean, like we just talked about, like there are always lower cost options. I will say some animal shelters do. If your pet has an emergency, if you're between not getting a procedure and having a procedure, a lot of animal shelters will do community clinics that are more affordable because they're government subsidized. And there's the AVMF, which is American Veterinary Medical Foundation, which is a grant program. But a lot of times, like Renee said, it's coming up with that money either through care credit or scratch pay or calling a relative, whatever it may be. And in emergency situations, that can be hard when it's a matter of time. So having that level of preparedness for if something bad does happen. Pet insurance, I have had multiple pets on it, and I've had different experiences with different companies. My dog just had a TPLO back in November, and they covered 90% of it. So that was great. And they, have been covering his rehab and his acupuncture and pain meds and everything like that ongoing too. So it makes a huge difference to only have to pay 10% of the cost.
All right, so let's move away from veterinary pricing and talk about some happy stuff here. Tell us, Dr. Emmons, what do you love about being a vet?
I love being able to build relationships with clients and their pets. I'm big on instant gratification when it comes to certain things. There are some procedures that I really enjoy. I really like doing nary surgery because I'm like, wow, they can breathe. I shouldn't have to do nary surgery. That's a whole other thing. Then on the opposite end of the spectrum, I love behavior, which is not instant gratification at all. It's a lot of patience and slow building relationships and making little tweaks and changes. I love the opportunities that vet med has given me in terms of education. I came into vet med, I was going to be a large animal vet. Now I'm a small animal practice owner doing GP and working for human mental health with NOMV. And I love that you can do stuff like that in vet med. Like you can go in, gonna be a wildlife vet, and you end up being a USDA vet for swine facilities. Like it's crazy. You can do anything. I do love what I do. It's exhausting a lot of the time, but I love what I do.
Yeah. The last time I took my dog to the vet, I was just watching how my vet greeted my dog. He got on the floor, was kissing my dog, loving my dog. And I just sat there and I was like, this vet is the best. His head vet tech came in, Laura. She's amazing. And it's just like, man, this job is just nonstop. So it's physically demanding. It's emotionally demanding, but the bonds that you guys make with us, like, it's strong. It's so strong. And when you say you love making those relationships with people and their pets and caring for them, that's how you're building value. Hopefully people see that. They recognize that extra time and energy you're putting in, because that's what makes us love our vets and our techs and go back and not just go down the road to the guy who's charging less for an office visit or less for a procedure. You're building that value in, and that's huge. That takes a lot of effort. I'm sure your clients appreciate that. And Renee, tell me what you love about your job.
Much props to the on the floor technicians. I do not have that muscle memory anymore. I think the thing that I love the most about my job is very similar. The relationships that we build, watching our patients grow and thrive. I'm also an instant gratification kind of person, and the behavior aspect, it's not instant, but seeing their progression over time, dogs that were COVID puppies that are fearful to walk through the threshold, to watch them follow our behavior plans, do the happy visits, let us help them, to watch them progress and be able to come in, get on the scale, go into a room. That's huge for some of these patients. We'll be like, Smokey's coming in. He's coming in. Let's see him do it. When he walks in all proud when 6 months prior he had to be carried. Seeing that, the wins definitely fill your cup when the other things may be taking some out of it.
Yeah. So let's talk more about that. What are some of the hardships that you both face? The things that make your days difficult?
A lot. Uh, there's so much love and passion that goes into this industry that I feel like we take it personally when anything goes bad. Like, was it my fault that the pet had a surgical complication, or isn't doing better after a prescribed medication, or isn't doing better after a behavior plan? Like Renee said, when you have those wins, it's like, thank goodness, because in an average day, I'm seeing probably half and half clinical complaints versus annual wellness. And even my annual wellness, like, almost always have an ear infection or something else. They've been limping, and there's always something else. And that unknown and that unpredictability, you never know what you're getting into going into a day. And I mean, you can start with a normal day full of puppy appointments and end up with 3 emergencies that you're euthanizing one and sending to the referral center and trying to do your appointments, and now you're running behind, and now your clients are mad because you're running behind. I am like super thankful. I have incredible clients. We have a very good client base, a very understanding client base. I'm also very obvious and apparent with how I run my practice, so they know what they're getting into. They know that we have a client expectations form of like, you will be nice to us or you will be fired. Because I am not dealing with it, I'm not letting my staff deal with it. Yeah. So we don't have to deal with that too much, but there are practices where I've had to call cops on people. We have panic alarms installed in our building. Like, people are wild these days.
Do you think it's because we're dealing with pets and we're passionate pet owners and just emotions are running high? We know that we don't really know how to help them. So we're going into the veterinary hospitals with desperation. Do you think that that's why it is? Or have we just become this like instant need for care? We want care now. Why can't you see me? And we're just demanding. Is it a combination?
I think it's a combination. And I will say, like, when I do lectures for NOMV, one of the things I talk about is emotional intelligence. So trying to have that recognition of, this person's usually very nice and they're usually very sweet, and today they're being a little wild, but their pet's kind of sick. So we're going to have a conversation like, hey, I know you're stressed. You can't yell at my staff. It's not okay. And most people apologize if you talk to them about it. But there are some people who fly off the handle and then, all right, we're done. But I will say there is often the expectation that I'm your general practice vet, so I'm going to take every single phone call that comes in that day. And I'm booked out for appointments for months, and we have ER blocks, but they fill up by like 8:15. We try our hardest, we do drop-offs, we do work-ins, but there comes a point where I will not be giving quality care. And we're very lucky to have urgent cares locally that can take the pet, or the emergency hospitals if it's more severe. And if I'm referring someone, I hope they know that it's for a good reason and that I would do anything to see them if I could.
Renee, tell me a little bit about what makes your job challenging.
I think a lot of the same things. Dr. Emmons hit it on the head. Managing client expectations can be tricky. And at a practice management level, you are the gatekeeper. So if there is somebody that's being challenging, whether it's on the phone or in person, you are the one to handle that. Because like Dr. Emmons said, we will not be yelling at our staff today. Someone needs to take the lead on that. And most of the time in practice, that's the practice manager. Some people apologize, some don't. And so a challenge for us PMs is we take the brunt of a lot of things. I have been spit on. I have been stalked. I have had my life threatened. I have had someone throw money at me.
Oh my God.
And it's hard when you're in such an emotionally charged profession as it is to be the calm, voice of reason. I think that is a very big challenge, not understanding why we can't see patients. Dr. Emmons hit it right on the head. There comes a tipping point where the care is not going to be as good because now we're overloading our doctors and technicians. I had a person call very upset we could not fit her in that day. Our ER spots had already filled up. We had a walk-in that was actively trying to bleed out on us, and everybody was full force. My dog happened to be sick that day, and he was sitting with me while I was at work, and she did not want to go to our local ER until I explained to her. I said, I'm probably going to see you there because my dog isn't doing well. There's no way my staff can work this dog in. So I'm going to leave and I'm going to go there too. I'm not going to call a client and say, sorry, you can't come today to fit my dog in, because that client needs to be seen. And I think that put it into perspective for her that we're not even seeing our pets today because that's where we are at a level. I think it's hard for people to comprehend the number of hands and brains needed to effectively assess, monitor, and care for patients. And there is a point that comes where we cannot fit anyone else in.
I can't help but draw these comparisons to human medicine, where it's like I could have something going on and I call my primary care doctor and I say, I need an appointment. This is really bad. And I can't get an appointment the same day. I don't expect that of my doctor. If I have a diagnostic study, I don't expect a call back the same day. I think we as pet owners have to be really careful about the expectations we have when we go to the vet clinic and the expectations we have of what people in the veterinary hospitals are doing for us. We've got to ease up because you're doing your best. It's hard physically, it's hard emotionally, and you're perfectionists and taking this to heart. You want the best for us and our pets. And not only are you taking care of the pet, but then you have to take care of us too. And I think that's huge. And we can't overlook that. When I go to my primary care vet and the vet tech is coming in and she's talking to me and giving me a little TLC and reassurance. And then when my vet comes in and he goes and he sits on the floor and loves up my dog, it's like in those moments, I think somebody's out in the waiting room right now, desperate to see the doctor, and they're taking a ton of time for me. And that's what I hope people think of. It's like when you're sitting there waiting, when you can't get an appointment, you guys are busy. We're giving excellent care. And so we've got to be patient. We can't have instant anything when it comes to veterinary care because you guys are already so overloaded. So talk to me, Dr. Emmons, about vet med whiplash. You taught me this. I never heard of it. I understand it, but tell us what that is.
Kind of what you were just talking about is we have to go to appointment to appointment to appointment and regulate our emotions so that we can take care of the pet in front of us appropriately and take care of you, the pet parent. I have a veterinary student with me doing an externship, and I did a behavior consult, which is an hour long of just talking. The owner was crying because the dog's been biting and they're stressed and they don't know what they're going to do. So it's a lot of consoling and like, this is what we're going to do. So it's heavy. I would say behavior work is usually pretty heavy. And then I went in to euthanize the dog that was not that old. I've been seeing him since he was a puppy, and it sucked and was awful. And then I went into literally a puppy appointment and I was like, this is crazy. Like I'm like, all right, ice my eyes. Okay, I'm not crying anymore. Hi, person I've never met before with your new puppy. Like, and you go in, and I know I'm good at compartmentalization. I think there are days where I'm not, because I'll sometimes have clients like, are you okay? And I love that they ask me that. You do so many things. You wear so many hats in a span of time. And in between those appointments, I'm making phone calls with lab work, like your dog's mass came back. It's cancerous. You need to do this. Okay, here's my next appointment for an ear infection. Great. Let's talk about allergies. Next appointment. Let's talk about this dog's limping. You need to go see the specialist. Get on the phone with the specialist. This dog needs a consult. until next appointment, it's just a roller coaster. And you have to be so much for so many people. If I went into every appointment super stressed, then the pet's going to feel it and the client's going to feel it. And if I'm in a rush and hurrying, that's not really good client care either. So making sure that people and their pets feel comfortable in taking that time in the appointment, it's a skill. It's something that we really have to work towards because it is a lot that we go through in just one day.
Remember, I was telling you about Dr. Christy Crow, and I follow her on Instagram. She shows what it's like to be a vet, the good, the bad, the ugly. And she was showing herself walking from one room to another and just talking about this is what I had to do. Just like you mentioned, like a euthanasia, a puppy visit. How do you manage all of that emotion? And it's more than just icing your eyes after you're crying, because there's a loss for you too, right? You care about that patient. How do you deal with that?
Prozac,
Okay.
Wellbutrin, therapy. No, I mean, there was a time where I didn't deal with it well, and I got myself into pretty significant mental health crisis. And because if you don't deal with those emotions at some point, they're going to get to you. So when I have a spare moment, taking the time to process and check in on my staff and say, let's cry about the fact that we euthanized this young dog today. Is everyone okay? And we do things like that, like debriefs for really stressful things. Like if we had a CPR, there are certain things that are full stop, the whole hospital stopping. We're going to deal with them in the moment. At the end of the day, I kind of go through each appointment and I'm like, all right, is there anything that's still lingering that I need to either remember to put in their notes, or do I need to call that client? Was there something that went well or wrong? And it depends every day. I will say, like, days when I'm there until 8 o'clock at night, I'm probably not taking as good a care of myself as I can be, but it's a work in progress. It's ever evolving. That's why I'm involved with NOMV.
Did you know you were going to have to deal with all of this?
I don't think you could have told 18-year-old me to not go to vet school. That's what it's what I always wanted to do. Like, I wrote that I'm going to be a veterinarian when I was in like first grade. I knew I was getting into the debt. I had worked in a small animal clinic in high school, so I was familiar with the traumas that you go through and how busy things are. I graduated in 2017, and by the end of that school, I was finally starting to see how much mental health impacted the profession. There are a lot of mental health issues that we're thankfully talking about now. But yeah, I don't think I knew the extent of that when I was getting into vet med. And I had never really been somebody that struggled with mental health until I was in practice. I graduated 2017. I bought my practice 2019. March of 2020, you may remember, pandemic. So I'm a new business owner. I'm really still a new vet. And my associate was diagnosed with pancreatic cancer. And so it was like everything went wrong. And I didn't know how to handle it. I didn't have mechanisms in place. I had suicidal ideations. I have enough of a support system. I'm very lucky. I recognize that I could get the help that I need. But that was something that was never on my radar. You know, vet school is stressful, undergrad stressful, everything that you do is stressful. And there's a degree of that, but like the piling and piling and piling relentless that can happen with this profession was not what I expected or was prepared for. But again, if you had told 18-year-old Shannon, vet med's hard and you might have mental health issues, I'd be like, psh, not a problem. I'll be fine.
Thank you for your honesty on that, because these are the topics that are going to help pet owners understand you guys better. Renee, how do you manage being that sounding board, that person who's got to keep everything under control inside the hospital? How do you deal with the challenges of that?
It's definitely tricky. You're worrying about your team, their mental health. And I think it's different in each hospital for the practice manager because we have privately owned practice and we have corporately owned practice. Privately owned practice, you're normally working with your practice owner, your medical director to come up with solutions, and you tend to be a support system for each other and how you run the practice. In corporate practices, it really all depends on who your director is. Your director normally lives across the country, has never been to your hospital, has never met you in person, and really is more of a like, send me my numbers and tell me what you want me to do type of system, which gets very challenging. It is hard when in our profession, we used to wear our burnout as a badge. I got here before everyone else. I'm here after everyone else. I'm the one taking care of everything. And practice managers especially put that on themselves. They'll work a 12-hour day at the hospital. They've been answering phones, trying to help out, do those things, and then they're home at night and then they're doing their actual practice manager paperwork job. That can be a really big challenge. And it's one that I decided I need to take a break from. So I actually have been out of practice for 3 weeks now, taking a break from the industry as a whole, because COVID was insane, especially from a management standpoint, because we had to go to curbside, like all these things that we had to invent and create and systems and processes to make it work. I'm super proud of the work that I did through COVID, and my teams coming off of that when we're in some sense of normalcy caused me to take a step back. I actually had a pretty major surgery in November. I was out on disability for 3 months. It gave me a lot of time to reflect and realize that I can still do good in a different type of capacity. That is what I decided to do. Who knows? Maybe I'll be back soon. Maybe I'll be back in a couple of years. I have no idea what that holds for me, but one thing that I do know is veterinary medicine is the profession that I love and am passionate about and will always follow and support, even in my new ventures. It was important for me to recognize when I was starting to struggle to do what I needed to do. We say it all the time, drink your water, eat your greens, but the reality is I had to practice what I was preaching and I wasn't. Taking that leap was super challenging, but I'm very excited about what I can do now. And that's one reason I'm excited about forums like this where I can use my experience to help others in this industry.
Dr. Emmons, you talked a little bit about NOMV or NOMV. Tell us about Dr. Sophia Yin and how she relates to NOMV.
Dr. Sophia Yin was a veterinarian. She was pretty big in the veterinary industry. If you've ever heard of low stress handling, that was her course. She was very big on behavior, did a ton of teaching. When you're in vet school, you have the veterinary nerd book, which is like this little pocket guide for basics on veterinary medicine, and she wrote that. She died by suicide, and nobody knew she was struggling. It came as like a huge shock, because if you knew, I mean, I never had the privilege to meet her, but if you knew of her, you're watching this smiling, bubbly, incredible person, and it's hard to believe that's what happened to her. The veterinarian, Nicole MacArthur, was like, oh my God, Sophia Yin died by suicide. Why did this happen? And she really didn't realize how much of an issue mental health was in the profession. She started a Facebook group, which was for veterinarians to come and support each other and vent and talk about hard things that they deal with on a day-to-day, and eventually became a 501c3. Since I graduated in 2017, I was watching them doing GoFundMes for people trying to get through mental health counseling or treatments. And I've watched NOMV grow into this organization that not only is promoting mental well-being in the veterinary profession, but we're talking to clients, we're talking to practice owners. We have a practice certification program now. We have support grants for individuals who need therapy or they can't pay rent this month. There's cyberbullying resources, there's domestic violence resources, and all of the things that affect mental health in the veterinary profession, we're trying to target and make sure are being met so that if people need it, we have it. Watching NOMV grow has been incredible. And one thing I do want to say is it's for everybody in the veterinary profession. So it's not one more vet, but it's not one more veterinary technician or support staff or practice manager or industry vet or shelter vet. It's anybody in the veterinary profession. It's a hard profession, and when good people like Renee leave us, it's heartbreaking because we want these people to be in the profession and we can't keep them. You know, veterinary professionals are on average 3 times more likely to die by suicide. We know it's a problem in our profession. We're trying to do something about it.
That's wonderful. Thank you for all that work. What could a veterinary professional do if they feel like they need to talk to somebody? What's the website or who should they contact?
NOMV.org is our website, and we're not a crisis intervention specialist. We can get people to the resources they need. We're not like 988, like your suicide crisis line. But if you go to our website, we have links to all of that. And we have links if you are struggling with LGBTQ issues or you're having suicidal ideations, there are specific resources for that. It's all on the website. And I'm always happy to talk to people too. And I think most of us are, if I can't help, I can usually find somebody who can.
That's beautiful. That's so good. All right. So let's talk about one last thing, and that is how can pet owners be better when we're dealing with our vets, techs, and our practice managers?
I think being kind, be a good human. It's really basics. Say thank you, be appreciative, don't yell at us. It's basic human decency. Know that if you're waiting, it probably means that someone else's pet is going through something worse than yours. And that's something to be thankful for. Be flexible, build a bond with your team. It's just that human interaction. If it's positive for everybody. You can send thank you notes to clinics. You can bring in cookies, write a positive review. There's so many things you can do that are like little extra bonuses. But I think on a day-to-day, like if I could just ask everyone to be nice to their veterinary professionals, that would be my biggest ask.
And it's really so easy, isn't it? It doesn't cost anything to be nice. And you never know that ripple effect. It's like just saying thank you, bringing in a little treat for the staff. You never know how that is going to affect somebody. If it makes your day just a little bit brighter, man, it's so easy to do. So, Renee, tell me some ideas. What else can we do?
I agree with all of those things. Try to come from a point of understanding, seek first to understand. I love my Brené Brown. If you're waiting, there's a reason, and it's not because we don't care. In our specialty practices in our ERs, to understand that, especially during COVID, they send out color-coded what they're taking and why, and usually first priority is patients that are actively dying. The other thing I think that is huge is to respect time. If you show up 20 minutes late to your half-hour appointment, you might not get seen, especially since COVID. There's so many no-call, no-shows. We could have utilized that spot to help another patient that we had to turn away, or your surgery as well. Canceling the night before. There's a lot that goes into planning a surgery. Now we don't have time to put another patient in that spot because that patient may need PVPs and they can't come pick them up, or certain labs that would have had to be done. So we have the staff and we have a spot and there's nothing we can do with it. That, timely and kindly, those would be my two.
And if we show up for our appointments, that means the vet can stay in practice. The vet that you love, the techs you love, the practice managers you love will be there tomorrow if you keep your appointments. Go online and give a 5-star review. It just takes a minute to do. Spread the love. That's what it's all about. You guys deserve it. Thank you so much for your time today and for teaching us more about what it's like to work in vet med. I really appreciate it.
Thank you for the opportunity.
Yeah,
Thanks,
thank you
Dr.
for
Emmons.
having us.